Welcome to Dental Sleep in 5, Episode 10. Oral Appliance Therapy versus PAP in a COVID-19 world. Disclosure: no vested interest in any appliance, device, or technology. I maintain a sleep disorders dentistry practice, conduct research, and provide educational programs. Our facility is accredited by the AADSM, and our facility and all the programs follow AADSM Guidelines. So the question you may be asking, isn't PAP first line of care for managing OSA? Well, apparently no. What are the benefits of oral appliance therapy versus PAP? Well, it reduces the likelihood of contaminating the surroundings with virus-laden aerosol through mask leaks. Oral appliances are easier to disinfect and maintain. So overall, during this pandemic, it is reasonable to assume that patients would prefer a therapy that both treats their OSA and does not increase the risk of COVID-19 transmission. Published just recently, American Academy of Dental Sleep Medicine. So let's review how we got here. COVID-19 pandemic has highlighted the medical implications associated with PAP aerosol, particularly concerning when one considers that OSA afflicts 1 billion people globally, and that most are managed with PAP, if they have any management at all. PAP has been implicated with spreading COVID-19 within the Washington State nursing home that originally became ground zero in North America. We essentially aerosolized it, said one responder after the fact. We made it worse. It was only later that the King County public health officials advised Redmond Fire and other first responders in the region not to use PAP for patients suspected of having COVID-19 illness. Redmond Fire has now discontinued the use of PAP for COVID-19 patients altogether. The PAP is prone to leaks at the mask interface is well established. In fact, ResMed, the inventor of PAP, states a mask leak is not simply good versus bad, it's a spectrum. Some degree of leak is quite acceptable. In other words, if the leak does not interfere with the therapeutic effectiveness, it's acceptable. However, when we're talking about a contagious virus being spread around the room, is any level of leak acceptable? The American Society of Anesthesiologists recently advised against PAP use for COVID-19 patients. This recommendation was based on experience with the SARS epidemic in 2003, along with studies that suggest PAP can pump viruses into the air, potentially increasing the spread of contagious disease. Dr. Camila Sasson, an associate clinical professor of emergency medicine at the University of Colorado School of Medicine, recommends not to use it because we are concerned about community spread, and we have to assume that anybody with respiratory distress is a COVID-19 patient. Toronto firefighters, just locally, on overnight shifts, they are no longer allowed to use personal use of their PAP machines at work. These firefighters will be shifted to day shifts only until the COVID crisis is over. And the precaution is taken to minimize the chance of spreading the virus, especially in light of the fact that some COVID-19 positive patients are symptomless. The AADSM current recommendations for PAP is that if a patient becomes positive, they should speak to the physician about assessing risks. Persons at risk, basically anybody else in the household. Patients should not stop using their PAP without consulting their physician first. And they should isolate themselves in the home if they have symptoms or are positive. They should also speak to the physician to determine if they should continue PAP use. One needs to evaluate the pros and cons associated with spreading the virus throughout the house versus the specific individual's circumstances and implications of not using it. So there's been much discussed about the new normal post-COVID-19. A new level of vigilance will be exercised with the use of PPE at our offices. Clinicians, team members, patients will all be dealing with some level of apprehension. Regarding oral appliance therapy, it will be interesting to see if the well-entrenched bias for use of PAP over an oral appliance to manage OSA will persist. Current events may greatly influence the manner in which physicians, dentists, teams, and patients view the oral appliance alternative to manage obstructive sleep apnea. Remember, even the very best fitting PAP devices leak. This is simply a limitation of the technology and acknowledged as acceptable by ResMed, the inventor of PAP. Now that we know about the liability associated with PAP, we can never unknow it. COVID-19 is not the first contagious virus, nor will it be the last. So this is recently published. Oral appliance therapy should be prescribed as first-line therapy for OSA during the COVID-19 pandemic. This is the current position of the American Academy of Dental Sleep Medicine. Quoted directly, oral appliance therapy is an effective treatment for OSA without increased risks for transmitting COVID-19. Patients who prefer oral appliance therapy may be more likely to adhere to treatment if they are confident that their treatment is not putting those in their household at an increased risk of COVID-19 exposure. With patient preference, the current guidelines, oral appliance therapy is a standard of care for all OSA severity. PAP creates aerosol and is cumbersome to disinfect. Oral appliance therapy does not create aerosol and is easy to disinfect. Given a choice, which would you prefer to use in a COVID environment? It's up to us to make sure that our patients have an understanding and are given a choice. Thank you and sweet dreams.